My name is Jennifer Mallory, and this video is intended for nursing students in an on-site hybrid environment. Lesson title, Identifying Possible Ebola Exposure in Adult Patients Presenting to the Emergency Department for Healthcare. This is a role play video for Ebola screening. This simulation is for patients coming to triage. This is the environment, Triage Emergency Department. Mr. Mark Mallory. Have a seat, sir. Hi, I'm Jennifer, one of the nurses. What brings you in today?
Got Ebola symptoms.
What kind of symptoms are you having? Well, first, sir, let's do some screening. We screen everybody coming into the emergency department for Ebola, and the signs and symptoms are headache, fevers greater than 38.4 Celsius or 100.4 Fahrenheit, nausea, vomiting, diarrhea, bruising to the body. Have you traveled outside of the country, sir, to West Africa?
Yes.
Has it been within 21 days?
Yes.
Have you had any fevers?
Yes.
Greater than 100.4?
Yes.
Any abdominal pain, nausea, vomiting, diarrhea?
Yes.
Okay, sir. He has answered yes to all the basic screening Ebola questions. This would make him a high-risk patient. I would next get a mask. Ask the patient to put on a mask. I would put on gloves and escort the patient to an isolation room with its own private bathroom. Then I would, from that phone, call my department, clinical nurse manager, and the chain of command and let them know that I have a high-risk Ebola patient. If Mr. Mallory had answered no to all the questions for abdominal pain, travel outside the country, not in contact with anyone from West Africa who's been sick, he would be considered a no-risk patient. Low risk would be he has come from Africa or he has been around someone from West Africa, but he is not having any symptoms, nor is the person having any symptoms. He would be low risk because he has been in contact with someone from West Africa but not necessarily infected. So what you want to screen for are symptoms, signs and symptoms of Ebola, basically travel history. This is recommended by the CDC to prevent an Ebola outbreak in this country. This concludes my role play video. Thank you.